Welcome everyone. Thank you for joining me today. My name is Devin Christensen. I'm a senior data analyst at IPUMS and the project manager of IPUMS PMA. This webinar is an introduction to the newest project at IPUMS, or IPUMS PMA. Just so you know, this is a pre-recorded webinar. As this is playing, I will be monitoring the chat and answer any questions that you might have while the webinar is going. For those of you unfamiliar with Zoom, at the bottom of your screen is a speech bubble icon that says chat underneath. If you click that, a chat panel will appear where you can enter in your questions. The general plan for this webinar is to introduce you to the data behind IPUMS PMA and how IPUMS integrates survey data. After that, I'll demonstrate how to use our website to find documentation easily and how to create your own custom data extract. After that, I will dedicate time specifically to Q&A. I'll do my best to answer by voice and by chat. Within a few business days, we plan to post a recording of this webinar and a summary of the questions in the chat and Q&A at ipums.org/support/tutorials. So for anyone just joining us, this is a pre-recorded webinar. Feel free to enter questions in the Zoom chat at any time. I will be monitoring the chat and also opening up a Q&A at the end. With that, we are ready to get started. First things first, for anyone who has never used IPUMS data before, it's important to discuss what IPUMS is. IPUMS stands for Integrated Public Use Microdata Series. One of the most important things to remember is that receiving data from us is always free. We are grant funded by a number of U.S. federal government agencies so that our data can be used for free by the research community. We are based at the University of Minnesota Twin Cities. We provide harmonized variables and codes on an online data dissemination system which contains systemized documentation at the sample and variable level. I will be showing you how to use our data dissemination system in the web tour later on in this webinar. IPUMS has been around for over 25 years, and we've integrated microdata series from censuses around the world, both historic and contemporary, and also labor force, time use, and health surveys. IPUMS PMA is included within IPUMS Global Health, together with IPUMS DHS, or the integrated version of demographic and health surveys. IPUMS PMA has similarities to IPUMS DHS in terms of topic and geographic coverage, mainly maternal, child, and reproductive health, family planning, and sanitation in low and middle income countries. Now we can finally answer the question, what is IPUMS PMA? IPUMS PMA is the integrated version of Performance Monitoring for Action, which is a high-frequency survey series that started in 2013. These surveys were initially conducted in 11 countries in Africa and Asia and are currently fielded in 9 of those countries. It was designed to monitor progress towards FP 2020 goals. Both the data collection conducted by a team at Johns Hopkins University and the integration efforts here at IPUMS are funded by the Bill and Melinda Gates Foundation. The FP 2020, or Family Planning 2020 goals, came out of the London Family Planning Summit of 2012. The overall goal of the summit was to reach an additional 120 million women using family planning by the year 2020. Individual countries, NGOs, and private sector organizations also made commitments and set goals. Some examples of country-level commitments are increasing method choice, organizing campaigns to increase demand for family planning, increasing access, and reducing the cost of family planning services. An example of an objective some countries set for themselves was to increase the modern contraceptive prevalence rate to a certain level by 2020. On the FP 2020 site, you'll notice that country-level monitoring towards goals are evaluated using PMA data. This chart shows method mix choice in Burkina Faso in 2018. Here is a map of the geographic availability of PMA surveys. Each of these countries have nationally representative samples except for India, the Democratic Republic of the Congo, and a few survey rounds in Niger. PMA data is collected at multiple units of analysis. Currently, there are household and female surveys, where each observation in the microdata is a person, organized within households. The core family planning surveys are collected this way, in addition to nutrition modules collected in Burkina Faso and Kenya. PMA also collects data from service delivery points such as hospitals, clinics, and pharmacies in the same small primary sampling units that households were sampled from, so you can link these data together in both the family planning surveys and nutrition surveys. Lastly, there are surveys conducted in Ethiopia at the infant level in a maternal and newborn health module. PMA was collected using multi-stage stratified cluster sampling. The first step was for them to work with the individual countries' national statistic agencies and divide each country into enumeration areas, or the small areas in which the latest census was conducted. They stratified these EAs into different groups, such as urban and rural or by subnational region, then took a random sample of the EAs. From the selected EAs, which contained at least 200 households, about 35 households were randomly selected. There was a household roster interview which determined the composition of the household. If there are any women between the ages of 15 and 49, the interviewer returned to give them the female survey. Each person-level data file contains normalized survey weights to estimate indicators that are representative of the target population. For example, India samples will be representative of women aged 15 to 49 in the region of Rajasthan, but Ethiopian samples will be nationally representative. Participating countries were surveyed at least annually. In a few years, the same country was surveyed twice, such as Burkina Faso in 2016 or Ethiopia in 2014. PMA employs resident enumerators to conduct the interviews. That is, the interviewers were women who live in the EAs where they were conducting their interviews, and they collected data using mobile phones. In-country teams processed the raw data first before sending it on to Johns Hopkins University for further processing and public release. This allows for rapid data collection and turnaround. The family planning surveys at the person-level unit of analysis are the core of PMA. There is detailed information about the household composition, sanitation and water sources, possessions, etc. The female surveys contain numerous topics related to family planning, fertility, sexual and reproductive health, and other information. Some countries have additional questions, such as migration and menstrual hygiene. The family planning facility data that can be linked to person-level data contains extensive information about the facility, including the family planning services offered, their staff, family planning products and other medicines that are in stock, and other health services that are provided there. In addition to family planning surveys, PMA has also conducted nutrition surveys in Burkina Faso and Kenya. The nutrition surveys were conducted at both the person unit of analysis and the service delivery point unit of analysis. The maternal and newborn health module was fielded in Ethiopia. It was a panel study following over 300 pregnant women, and the data is provided at the infant level unit of analysis. As I've mentioned a few times, a key innovation of PMA is the collection of service provision data that can be linked to the person-level data of the same country and year. We recommend that you calculate information at the EA level, such as the number of hospitals or the number of facilities that provide a particular family planning method within that small enumeration area. Then you would attach that indicator at the EA level to each person record. There's a user note on our website about this with sample code in Stata, R, SPSS, and SAS. Now that we've discussed the original data behind IPUMS PMA, I'd like to show you what IPUMS does to help researchers more easily work with the data. We say that IPUMS PMA is the integrated version of PMA data. Integration has multiple components. First, I should emphasize that IPUMS PMA contains microdata. Microdata are stored in large files where, in general, each observation is a person or a facility. So that means each row is a person. This is in contrast to aggregate data, such as frequency tables or cross-tabulations. Here's an example of IPUMS PMA fixed with data, as if you had opened a data file in a program such as TextPad. In an IPUMS PMA file, you can pool many samples together. In this example file, we have a family of 3 in Kenya, a family of 5 in India, and a family of 4 from Burkina Faso. So while each row is a person, each column represents a different piece of information. So here we have the survey identifier. We also have a household identifier, so we know how to group these people. We have a household level piece of information, such as the urban or rural status. And then we also have an individual level piece of information, such as this person's age. So first, we ensure that variable names and codes are harmonized over time and space. When a variable is available in different data sets and they have different names, but they originate from the exact same survey question, we rename them so that when different data samples are pooled, you analyze that variable in both samples in the same analysis using the same name. We also systematically document each variable. We'll go into more detail about the documentation in the web tour. On our website, you can also build your own custom data file that includes only the variables and survey rounds that you choose. In cases where codes are not consistent across data files, that is, the code values don't correspond to the same category, we recode to a new unified coding scheme that retains all detail. For example, PMA asks the woman the highest level of education that she has attended. Each country, having a different education system, understandably has different coding schemes for education level. We call these input codes. Our goal is to create output code that is harmonized across country. We then reorganize these input codes such that we combine comparable groups and we sort the groups from lowest to highest education. Never attended and primary education groups are comparable. We assign all never attended to 100 and all primary to 200. Only Kenya has a post-primary/vocational group, so that will go between primary and secondary. We then create general groups of secondary and tertiary or higher. Burkina Faso and Kenya have additional detail for secondary schooling, so we will nest that detail under the generic secondary group. We will differentiate that extra detail by using the second digit. In case additional detail is available in future samples, we are allowing for the third digit to further delineate nested relationships within these categories. In the same way, we separate college and university and postgrad under tertiary or higher. We can also simplify these codes by keeping only the first digit. We also have another version of this variable that groups education categories even more broadly to compare across countries. In summary, the key advantages of IPUMS PMA are the frequency of the surveys to observe change over time and comparing across countries within the same time period. The service provision environment the women live in is also a key innovation. Another advantage is the availability of taboo topics such as menstrual hygiene and pregnancy termination. Also, IPUMS has added population weights based on the normalized weights so researchers could estimate approximate population counts. The main disadvantage in PMA lies in the fact that PMA is very new. There is currently a limited geographic and topic coverage compared to similar data projects such as the demographic and health surveys. However, in the near future, PMA will be adding additional value to data in this field. The survey design is shifting to a longitudinal design so that researchers can follow the fertility behaviors of the same women over time. More maternal and newborn health data will be collected through PMA Ethiopia, and PMA is also adding client exit interview surveys from the service delivery points. Now it's time to move to the web demonstration. Let's say I wanted to download a set of all samples from 2018, and I want to know the percent of women in these countries who have ever used family planning, then compare between rural and urban areas. I'm starting at the IPUMS PMA homepage, pma.ipums.org. In order to download any microdata from our website, you'll need to register for a free account. However, you are able and encouraged to browse through the online data dissemination system without an account. When you register, you'll be asked how you plan to use the data, so you might find it useful to browse through the variables to see what's there. To register an account, click on Register from the homepage. We have a static version of the registration form in French for your reference. You will still need to complete the English version of the form. We ask some basic questions such as your institutional affiliation and occupation. This helps us understand who our audience is. Select the countries that you would like to analyze. For the purposes here, I'm going to add all of them because I want to do a cross-country analysis. We ask that you tell us a bit about your research interests. For the most part, we are making sure that you are not attempting to use the data for commercial purposes. I check the registrations just about daily, and if you have a reasonable request, I will approve your application. Then you'll receive an email, and then you'll be able to log into your account and access the microdata. We also ask that you agree to our terms of use. And then after you've agreed to all of those, then you'll submit. Okay, so I'll go back to the home page. We also have a lot of resources for you to get started. We have a user guide over on the left side here. From this page, you'll be able to access a lot of information about these data and about how to register, links to video tutorials, but also some general sample notes for different types of data files that we have. We also have some user notes about which weights to use, our weighting guide. And we have user notes on the population count weight, and also a user note on how to use the service delivery point data with the female data. We also make the original survey questionnaires and dataset notes from PMA available to download. At the support link, you'll find other user resources such as links to video tutorials, our FAQ, more links to the user notes, and a link to our IPUMS user forum. And as always, the IPUMS user support email is there if you run into any technical issues. We also have some data exercises if you'd like to be walked through different data analysis examples in your preferred statistical program. Now we're ready to take a look at the data dissemination system. Let's say I wanted to compare the proportion of women who have ever used family planning across rural and urban areas and compare across countries. So first, I want to select data. I'm greeted with several options. I will select family planning person level. First, I'll go to select samples. This will help simplify the display of the variables as I browse. This is a grid of all possible person-level family planning surveys. I could choose to select all, or I could select all samples from one country, or all samples from 1 year. And I'll go with all 2018 surveys. One thing about PMA that is different from most other IPUMS projects is that we have a case selection feature right here on our sample selection page. In the original PMA data, they kept non-response cases in the data file in order for users to calculate response rates. These cases have very little information in them, and the weight variables already control for non-response. So we allow users to download the files without these cases. The default selection is female respondents because they have the majority of all the data in these files. If you'd like to keep household members or people who did not respond to the female survey or people who are not women aged 15 to 49, you can also choose female respondents and household members, or you can keep all of the cases. For the purposes of what I want to know about women who have ever used family planning, I'm going to stick with the default female respondents. So I'll submit my sample selections. Now I'll browse for the variable representing whether the woman had ever used a family planning method. I'll go to the topic group, Ever or First Use of Family Planning. Because I know the variable I want, FP of use, I will add it to my data cart by clicking the plus sign. I can see by the availability grid that this variable can be found in all the samples I've selected. And that means when you see an X, that means it's available in that sample. So you'll see for injectable type, it's not available in Ethiopia or India. But if we wanted some extra information about this variable, I can click on the variable name. So first we'll see the Codes tab, where I can see the available categories for each sample. I can choose to view the unweighted case counts as well, and can change the case selection view here. This won't affect the cases in your data file, however. You'll notice that when I change to include female non-respondents, cases show up in the not interviewed group. Then when I include household members, a lot of cases show up in the not in universe group because only women aged 15 to 49 were asked about family planning. I can also go to the description of the variable, including which questionnaire it appeared on, so the female questionnaire. This is to help the user decide which weight variable to use. We also document comparability issues within the variable over time. In this case, there were no comparability issues. For key indicators, we also document whether there is a comparable or at least similar variable in IPUMS DHS. So this particular variable was worded the same way across samples, and we can confirm that on the questionnaire text tab. So looks like it is always phrased the same way for all of the samples that we have selected, thus no comparability issues. Lastly, we always document the universe of the question, which means the person who was asked that question. This is particularly important for understanding what your denominator is if you're calculating a proportion or a similar indicator. So returning to what I said earlier about the indicator I wanted to calculate, I will also need a measure of urban-rural status. So I'll return to select data. While I know that urban-rural status is going to be in the household geography variable group, but in case I didn't know where to look, I could use the search feature. So I will type urban, and then I will find that urban-rural status comes up. One thing to note about urban is that each country's statistical office determines whether the household lives in an urban or rural area. The comparability tab for urban documents the urban definition for each of these countries. I'll need to keep this in mind when I do my analysis. I'll add this to my data cart now. So I'll go to Add Cart. The last thing I'll need in my cart is the weight variable for the female questionnaire. So go back to Select Data. And again, I know that this is under Technical and Weights and Estimation. FQ weight, because this is from the female questionnaire, is the appropriate weight variable, and it's already pre-selected for me, so I don't actually have to add it. So now I can create my data file. I'll go to View Cart and review that the variables I expected have been added. So I added urban and I added FP EVUSE. So then I'll create my data extract. So I personally am a Stata user. So in case this didn't already say Stata, or if you want to have a different data format, you can go to Change, and your options are Fixed With, and that will come with do files to help you read it into different statistical programs. You want to choose that option if you use R. You can also choose Stata, SPSS, SAS, or CSV. And this gives you another opportunity to change your case selection for the people in your data file. So I'm going to stick with Stata and female respondents. And lastly, I'm going to describe my extract. So this will say, ever used family planning by urban status. So then I would go to Submit Extract. But notice I'm currently not logged in, so this will prompt me to log in. All right, so I have submitted my extract, and this is telling me that it's currently in processing. And this is where my data will appear, and here's my description. So I would wait for an email, and then as soon as I receive it, then I would refresh my page. All right, so after I refreshed, I have a link here so I can download the data set. So I would right-click and I would choose Save Link As, and then I'll be able to save this onto my computer. Keep in mind that when you download this file, it will be a compressed format, so it'll come out the extension .dta.gz. So all you have to do is download a free decompression software if you don't already have one on your computer. There are some video tutorials on how to decompress that data, but once you've decompressed, then you can open up just like a normal data file, or if you're reading it with the do file. So now I have downloaded my data extract onto my computer. It's right here, and it has the extension .gz because it is compressed. So I am going to use my decompression software, 7-zip. It's free to download. And I will extract here. And that gives me this Stata file. So now I'll open it in Stata. And here are the variables that I included in my extract. First, I'm going to run a tabulation of my main variable of interest, FP EVUSE. Just under half of this entire sample of women have ever used family planning. I'm going to drop out the missing cases. So first, I'm going to see what the code is for no response or missing. I can either go to the website and look up the code on the variables codes page, or I can just use this option in Stata. So looks like no response or missings are 98s. So I'm going to recode those 98s as missings for the time being. Okay. So I'm also going to use a survey set command to make sure that I'm seeing representative estimates. And then FQ weight is my female level weight. There are strata as part of this survey sample design. And then the primary sampling units are the EAs. So the variable name for that is EAID. Okay. And now I would also like to see each country separately first. So let's see, SBY, and then we're going to look at country and ever used family planning, and I want to get a row. Okay. So among these countries, Kenya has the highest proportion of women who have ever used family planning in this sample. And this is weighted, so this is nationally representative. In contrast, Nigeria has the lowest proportion of women who have ever used family planning. Because of the comparability issue with urban status, I won't look at a simple crosstab of FP use and urban. Instead, I want to compare family planning use ever by urban status for each country individually. So first I'll start with Kenya. And because FP use is a 0 or 1 variable, if I take the mean, that will give me the same as a proportion. And I know offhand that the code for Kenya in the variable country is 7. And I want to compare over urban status. So as you can see that there's a higher proportion of women in urban areas compared to rural areas who have ever used family planning. Let's look at the same thing for Nigeria, which had our lowest rate of women ever using family planning. And the pattern still holds here. Almost 45% of women in urban area have ever used family planning compared to about 27% in rural areas. So now we have the answer that we were looking for, and we're about to wrap up this webinar. If you have any questions after this webinar, you should always feel free to email our user support. We also have an IPUMS user forum so that you can ask questions of other IPUMS data users. But for now, I'll switch the pre-recorded webinar off, and I'll be available right now for questions via the chat.